Welcome to Vaisingumo Šaknis, or in English, Fertility Roots. It's a platform based in Lithuania where we share evidence-based information about fertility and reproductive health. My name is Ieva Miceikaitė. I'm the founder of this platform, a PhD candidate and a researcher in biomedicine and human genetics. Our goal is to provide support and empower everyone on their journey to conception and healthy pregnancy. One of the topics leaving individuals seeking natural ways to boost their fertility frustrated is the lack of knowledge about nutrition and supplements and how they affect our fertility. So today I'm joined by Dr. Birgit Wogatzky. She's both a doctor in biology and expert nutritionist specializing in fertility optimization. So she will share her knowledge and help to shed the light on the topic of nutrition and supplements in fertility. By the end of this episode, you will have a clear understanding of this topic and will know what to avoid and what to add to your diet to improve your fertility. So let's get started. Hello, Birgit. It is so nice that you could join us.
Hello, Eva. It's a pleasure to be here on your channel. Thank you so much for having me.
Oh, we are really thankful to you. And so we just want to start exactly from very start and from you. So what inspired you to focus on fertility and reproductive health through nutrition?
Thank you so much. That's really nice to ask about that. By training, I'm a biologist, but privately, I'm a mother of three. And for me personally, having kids, having a family, that's really so important in my life. But I've had some very close friends struggling with fertility issues. So I also know what a challenge this can be. So it was a very lucky coincidence when actually our family moved to Austria, where back then my husband got the position of the leader of the medical team in the IVF, in the fertility clinic there. And it was a very state-of-the-art fertility clinic, very fancy, advanced lab, very skilled people there. And they were very open, not only to new lab techniques, but also to all sorts of supportive things. For example, they accessed Chinese medicine, meditation, all sorts of things. And then by roughly 2010, I was part of a study they did assessing lifestyle factors, impact on semen quality. And they had a look at the lifestyle of more than 1,600 of their male patients. And very soon it became clear that there was a big need for more information and for more support when it came to lifestyle, and especially when it came nutrition, because we saw the strong impact of nutrition on semen quality, and we saw that many of our patients found it very difficult.
So, that's such an inspiring story, actually.
That was actually the start for me personally, because the data was so convincing. I added an education as nutritionist, and it was also the start for the Fertilovit product line, and I've been medical advisor of this product line ever since. So it's really
and this is actually a very nice line of supplements, which are very actually popular among our listeners, among the community in Lithuania. So we are very happy actually to talk to you about them as well.
Thank you.
So talking about nutrition, why is it so important when trying to get pregnant? We know that nutrition, our lifestyle, environment influences our health in general, but somehow it feels that the reproductive system is somehow different from our nutrition, and it's not affected. And a lot of people do not even think about the association of those two functions and of those two systems. So could you tell us, in short, why is it so important to look at your diet and the supplements you take when trying to get pregnant?
Yeah, actually, I think that's really a very good point, because that's what a lot of people think and feel. And, like 10, 15 years ago, even the fertility experts would feel similar about it. And our view about the importance of nutrition has only changed as soon as research found out the immense effect a teensy vitamin can make. I'm talking about folic acid. You see, folic acid is needed so that the neural tube of the very, very early embryo can close properly. And if not enough folic acid is present in the maternal body, in the mother's body, then this closure doesn't work properly and the child will suffer from very severe malformations. And we know today that simply by making sure that mothers get enough folic acid, we can reduce the risk for these severe disorders by a staggering 70%. Such a simple thing to have such a big difference. So this research, this knowledge was, so to say, the starting point to look more into the impact of diet on fertility and on the health of children. And today, we have learned so much about the impact of diet on healthy fertility. Let me give you another example. For example, today we know that women who are strongly underweight, just as very strongly overweight, they experience a change in their endocrine balance, leading to a disturbance of their monthly menstrual cycle and interfering with their fertility. That's one thing where diet is important. Also, we know that people who consume lots of junk food unwittingly take up building blocks that fuel inflammation in the body. We call this silent inflammation. And we know that this silent inflammation is detrimental for oocyte health, but also for the quality and quantity of spermatozoa in semen. And the same is true, for example, if we eat a lot of junk food, we don't have usually lots of fresh fruit and vegetable, which are an extremely valuable source of antioxidants. And we know that antioxidants are very important to quench detrimental oxidative stress, which can harm especially spermatozoa, but also oocyte health. So there are many different pathways and mechanisms which we know of today.
Oh, it is such a great, actually, knowledge. And when you put everything together, it kind of feels that everything we do and everything we eat, it actually affects also our fertility. And you mentioned inflammation. So I'm wondering about other issues with reproductive system and health issues, like, for example, endometriosis, which is also one of the causes of infertility. So are there any dietary changes or supplements needed that could help in this case?
Absolutely. And that's a very question I get a lot, because today we see that 1 in 10 women of reproductive age on average is affected by endometriosis. So it's a very common thing. In endometriosis, of course, we have a high inflammatory situation. And this is not only one of the reasons for the severe pain the women have to experience, but it also can impair oocyte quality. Now, to gently lower these inflammatory levels, natural way, I usually recommend as a first step for the women to have a check for any food intolerances. You see, we know today from studies that more than 90% of endometriosis patients have one or another form of food intolerances. And if they don't know about it and don't avoid these foodstuffs, this increases the inflammatory situation in the body. The other thing is that we ask our patients to follow an anti-inflammatory diet. This is rich in fresh and seasonal and organic fruits and vegetables, and contains lots of healthy fats to gently lower inflammation levels from within. When it comes to supplements, that was also a question of yours, we ask the patients to have their vitamin D status checked on a regular basis. We all know that vitamin D is not only a vitamin important for bone health, but also for our immune system. So that's important. And these patients benefit from anti-inflammatory and antioxidative supplements.
That's very good to know. And talking about anti-inflammatory diet, you mentioned that there should be a lot of vegetables and fruits and healthy fats. So it's something similar, I guess, to the only diet which is actually well researched. It's like Mediterranean diet.
Yes, absolutely. The Mediterranean diet is the healthiest diet we know today and would be strongly recommendable for endometriosis patients as well. But always making sure that they avoid anything they may be intolerant to. That's important.
Definitely. That is a very good point. That's a very good point. Thank you. So what about PCOS? Because it is also a very common disorder in people who actually have some fertility issues. And that is usually one of the reasons how it gets diagnosed, because they cannot get pregnant and then they go to their doctor and they find out that they have PCOS. So what kind of nutrition could help them to actually improve this condition? Is there anything like that?
Oh, yes. Actually, PCOS, for me as a nutritionist, it's sort of my favorite issue because nutritional changes work so well. You see, in PCOS, the metabolic situation and the hormonal situation, they're so closely intertwined. And it works really in both ways, especially the carbohydrate metabolism plays an important role. And we can really help to gently rebalance the hormonal situation by making sure we adjust the carbohydrate metabolism. And to do this, we ask the patients to avoid blood sugar spikes in their diets. So we ask them to avoid sugary drinks, for example, to go for whole grain products rather than white flour products. Also, it's really important to have lots of, generally speaking, lots of fiber, healthy fats, antioxidants, again, important because these patients also have an increased level of silent inflammation and oxidative stress. And in PCOS, I find that many women they are very motivated to the changes, and the motivation is even exacerbated because very often they will see first results for themselves after 4 to 6 weeks only, when they feel that their cycle starts to kick in again, and also their skin and hair gets nicer. And for us women, this is important. And very often,
Definitely.
yeah, so that's really a very excellent indication for nutritional interventions. Yeah.
Oh, that is so good to know, because I know that among our community, among the listeners, there are so many people, so many women who actually are affected by PCOS, as it's also quite common.
Yeah.
So I hope we gave you a lot of good chances to improve your health. So now switching to supplements. What could be the main key ingredients in fertility supplements? That, like, when people are looking for fertility supplements, what kind of ingredients they should look for?
Yeah, thank you. That's an excellent question, because we need to talk about basic supply, what each fertility supplement should contain. But we need to make sure not to talk about men and women together. So we will talk about women first, probably. Yeah.
Very good. Yes, let's separate them.
So we've already mentioned this very important small micronutrient, folic acid, which is in fact a B vitamin. So folic acid should be an absolute key ingredient of every fertility supplement because of its important role in protecting the developing baby from neural tube disorders. And even women who eat very healthily, who stick to a very healthy diet should supplement it, because while folic acid is abundant, especially in green leafy vegetables, it's very sensitive towards heat and light and gets destroyed very easily. Also, bioavailability from food is rather limited. This is why health authorities from most countries in the world recommend that women planning for pregnancy supplement at least 400 micrograms of folic acid per day from the time they start planning for pregnancy well into pregnancy itself. Because, neural tube closes very early in pregnancy. That's why we need to start early. Mm-hmm. Also, another aspect is that many women who have used hormonal contraception before they decided they want to have a baby are not aware of the fact that, for example, the contraceptive pill drains the body of folic acid. So the need is even more elevated to really take folic acid supplement. Oh.
That's a very interesting fact.
Yeah, I really, from my perspective, we would need more education about that, because it's really a risk factor for many. Another supplement that's very important is also something we've already mentioned with respect to our endometriosis and PCOS patients, is vitamin D. We see today that in Middle and Northern Europe, more than 80% of the general population do not get enough vitamin D. And vitamin D, we know today, is way more than vitamin. It's more like a hormone, so to say. And it has so many different roles in our body. And it's also very important for healthy fertility. So that's something I would recommend to supplement to have as in every fertility supplement. And the third absolute basic ingredient is iodine. And we know, for example, from a study done by the University of Riga published in 2017, that many pregnant women do not get the recommended dosages of iodine. And you see, even small deficiencies are detrimental for the developing baby, for thyroid function, but also for brain development. So it is really important to supplement iodine from very, very early and to have it as a basis for every fertility supplement. The only exception are women with specific thyroid disorders such as Hashimoto's. For them, different recommendations apply.
Just as an overview, the three main ingredients to look for would be folic acid, vitamin D, and iodine.
Exactly.
Those are the main ones, except, of course, iodine, as you mentioned. If you have any thyroid disorders, definitely you first need to talk to your doctor about that and avoid iodine in supplement form in those cases.
Yes.
So that was very interesting. And for me, it was very interesting to actually hear about the study from Latvia, because I was under the idea that nowadays, at least the deficiency of iodine is not anymore seen in Europe, at least, or in other countries which are more developed countries.
Yes, that's what you would think. So I was quite surprised by that study as well. And it really, again, makes a point how important supplementation is when it comes to iodine in Europe. Many countries have, meanwhile, mandatory iodine fortification programs, and that's the reason behind it, but not every country.
Okay, yeah, so that definitely helps. No, it's very interesting and actually sad also to hear that we still deal with that issue. And so for everyone listening, it is important to also actually take it into account, thinking about their own health. And I know that when we talk about Fertilovit fertility supplements, that you are actually medical advisor of, I know that all of those important ingredients are there because I actually researched them. And I wanted to ask them, what sets Fertilovit apart from other fertility supplements in the market?
Thank you so much. Yes, of course, Fertilovit supplements have been developed in cooperation with fertility experts, and by far they exceed this minimum supply. They are designed for men and women who want to have a very comprehensive support of their healthy fertility. Also, rather than having a one-fits-all product, we have a very indication-adjusted product line catering for the specific needs, for example, of IVF patients who want to support oocyte quality, of patients with Hashimoto. We have already said they have a different demand than the general population, patients with endometriosis, patients with PCOS, so very specific. All of the products are produced in Germany under very high quality standards. And for us, it was very important to have very pure quality, so there are no artificial colorants. The majority of products is free from any animal ingredients. So it's very pure and very clean quality, no gluten, no lactose. All of these things were really important to us.
That's very good to know. And here we talk about what's important for both, of course, for both in the couple, for men and women. But generally, when you look for fertility or preconception supplements, what is available, actually, usually it's for women only. Mm-hmm. So we know, of course, that male health also and sperm health also affects conception and even pregnancy. So it seems that it would be important to have supplements for males, for men as well. So I know that in Fertilovit you have M+ supplements specifically to improve fertility for men. Could you tell a little bit more about them? So how do they improve the fertility, and when is it actually helpful to take them?
Mm-hmm. Yeah, thank you so much for pointing this out. As in the very beginning, we talked about that, well, supporting male fertility was even the starting point of the whole Fertilovit product line. Mm-hmm. And for one thing, we see that quite a few of our male patients find it very difficult to stick to a healthy diet. That's certainly one aspect. But the other aspect is, imagine spermatozoa. During their development, they lose the majority of what we call their cytoplasm. And this is a part of the cell where the biggest part of defense and repair mechanisms are located. So the spermatozoa losing this protective part of their cell, or the biggest part of it, they're very susceptible to detrimental outer and inner influences. And we see very often, if there is pollution, if there's inflammation, if there's oxidative stress, the biggest part of our body can compensate for that quite long. But in men, the spermatozoa are among the first cells that respond. And we see that sperm count decreases, but also the way spermatozoa move, the way they're shaped, and so forth. It affects all of this. On the other hand, we have learned in many, many studies meanwhile that in most male patients, by providing a supplement during the time a new spermatozoa develop in the body, and that's probably something we need to point out. You see, semen quality, it varies over time. And in every healthy male body, spermatozoa develop anew in a process that takes roughly 3 months. And if we, during this time, provide very, very good prerequisites for that development, we can effectively support semen quality. And when we use supplements, what we can do is we can support really the spermatogenesis by providing building blocks for healthy sperm development. We can protect spermatozoa from detrimental outer influences such as oxidative stress. And we can provide micronutrients that help the spermatozoa to generate enough energy for their long way to reach the oocyte. And by doing all of this, we see that roughly 60 to 70% of men who have issues with fertility benefit from this supplementation. We see increases in sperm count and concentration, improved movement, we call this motility, and the shape of the spermatozoa becomes better. And we know from studies that even the DNA, which of course is the most precious part of the spermatozoa, becomes more stable and healthier.
So it's around in 3 months, as I understand, it's possible to actually improve sperm health.
Exactly. One developmental cycle takes roughly 3 months. And we see that if we support sperm health during this time, these 3 months, then we have really, really nice benefits for the men who do that.
So that could be one of the main things to actually start with, because every health procedure, everything starts with a woman. So it's very important to pay attention to men. And as in majority of the cases, it's actually quite easy by changing your lifestyle and changing your diet, adding some supplements to actually improve sperm health, motility, morphology, and so on. So I think that is one of the first things actually everyone should do when trying to get pregnant.
Absolutely. And it's a very easy step. In addition to that, I really encourage men to go and see their healthcare provider if it takes longer than expected to become pregnant, because of course the man is involved in 50% of cases. I mean, they're just as important.
Exactly.
And very often men are a bit hesitant about talking to their healthcare provider, but there is no need to be worried or not see, because very often it's also small things like infection that puts stress on semen quality. Then if the healthcare provider cures the infection, then you take a supplement, mind a healthy lifestyle and diet, you will see your sperm health, your semen quality can recover. And it is amazing the differences in results that you can see.
Actually, I'm also talking to the clients, to the people in the community, and they say that, wow, it's been a year, more than a year, we've been trying. And then finally, my husband went to a doctor. We found out that there was some issues with concentration of spermatozoids and so on. And we just changed the lifestyle. He started eating healthy, and now we just got pregnant. Sometimes it seems so easy, but it's for some reason still overlooked. So I think it's very important that we actually talked about it, about the male factor in the fertility.
Absolutely. Our men are important. So really need to look after them.
50-50. Yeah. So talking more about the fertility supplements also, and the Fertilovit, for example, maybe, some interesting also research studies to share about the effectiveness for fertility supplement effectiveness.
Yeah, as we've talked about in the very beginning, I'm a scientist by training. So for us, of course, it was really important not only to have an idea about something that could work, but to prove our hypothesis. And meanwhile, we have 3 published studies in international peer-reviewed journals about the efficacy and safety of using Fertilovit M+ to improve semen quality. In 2 of the studies, we assessed the effects on semen quality itself, so on sperm count, sperm concentration, motility, and the shape, the morphology of spermatozoa. And what we saw was a significant increase after 3 months treatment. And interestingly, the higher the limitation of semen quality was before the treatment, the better the results or the greater the improvement was afterwards. That was very interesting. Also, what was really interesting for us, we used a high magnification method assessing the morphology, the shape of spermatozoa in detail. We used a 12,000-fold magnification to assess sperm quality. And here we saw that the percentage of healthy-looking spermatozoa increases as well. And in spermatozoa, we see that the outer appearance very often is associated with the way they are able to do their job. So that was really interesting. Mm-hmm. But for us, we sometimes got that question by men who said, look, I need to undergo an IVF treatment anyway, so does it make any sense for me to take that supplement anyway? So we did a follow-up study, and we asked ourselves, what happens if patients get the paternal supplementation? Does it have any impact on their fertility treatment? And we enrolled 92 couples in that study. And in they had a first treatment cycle without paternal supplementation, and a second later treatment cycle with paternal supplementation. So given that the second cycle was later, of course, the female partner had become older. So we basically worked against ourselves with that study setting, because we would expect that the results got worse because she had become older. Sorry, girls. But what we saw was quite the opposite. We found much better success rates, especially the quality of the blastocysts had increased. We saw increased pregnancy rates and so forth. And with this study, we are now very confident that it really makes sense for every man to really have a look at his lifestyle and diet and use supportive supplementation 3 months prior to planned pregnancy in this case.
Wow, that is really impressive. So, because IVF is, usually a treatment you take when there are some issues. Well, it can be any other issue as well, but majority of the cases are also when it's a male infertility or just subfertility, and it's a little bit lower sperm quantity and quality. So if it's possible to, even without really thinking about improving it so much that it would be possible to achieve pregnancy naturally, but wanting to improve IVF cycles and IVF success, which is the main thing actually, because as we know, IVF is not 100%. And you never know if it will be successful or not. But if it is possible to do anything to help achieving success, better success. So that's, I think, the important thing that everyone should start actually implementing. And as it is so easy just by changing your diet and lifestyle. And men, definitely your part in it is big.
Absolutely.
So it's very interesting to hear about that.
Yeah.
Because even in those cases, because IVF mainly is, all of the procedures are mainly happening in the woman or to a woman, and she's getting all of the medications and all of the preparations, procedures are looking at the egg growth and how they are actually retrieved and so on. It seems that the man is again somewhere on the side, just looking how everything is happening. But actually the part is really big here as well.
Absolutely. And, we all know how much stress it puts on every couple to undergo that IVF treatment. And isn't it great if we can do something to support treatment outcome ourselves, to improve our chances of success. And I also would like to add, I think it's also really nice that if men really actively participate by adjusting their lifestyle, diet, by supplementing something, it is also such a great help for the female partner to really see that he is actively participating, especially as you've pointed out that so much of the treatment revolves around her. So this is really, a big help.
You need two people to dance tango, as they say, and that's how it is in trying to get pregnant. So it's not only women's problem, it's not only men's problem as well, but it's both of you working together. It's actually much better also psychologically, because you can help each other and just in those difficult moments, because definitely there are those. Absolutely. So we were talking about everything what's important to add to improve the fertility for women and men, but are there any foods or supplements which people should avoid when trying to get pregnant?
Mm-hmm. I think that's an excellent question. Thank you so much for that. We know today a little bit more about that, thanks to data from America, from the American Nurses Health Study, and authors such as Jorge Carvalho have summed all this data up in a book called The Fertility Diet. And we know today that it is not very good for fertility of men and women if we consume lots of red meat, in particular, red meat and sausages. Also, it is not a good idea to consume a lot of unhealthy fats, especially so-called trans fats have been found to impair our health and fertility. And so this is something you want to avoid. Another aspect is if we consume a lot of food that it has a lot of pollutants, this is something that will decrease our fertility. And what is also important is really to avoid sugary drinks, for example, everything that is has a very, as we say, high glycemic index, because, and we've already mentioned that very shortly, our carbohydrate metabolism is very, very closely associated to our hormonal system. So we don't want to bring this out of balance. The second part of your question was referring to any supplements to be careful about. Now, for one thing, for women, talking about women again, women are recommended not to supplement vitamin A during preconception and pregnancy, because vitamin A is a fat-soluble vitamin. That means if we take up more than intended, it will be stored in fat tissue. And we know today that if levels of vitamin A become too high, this can impair the baby's healthy development. So you want to stay clear of that, not to take up too much vitamin A unintendedly. Also, I ask everybody to be a bit cautious about any herbals. We know today many people perceive herbals as, it's natural, it's no harm done. And when it comes to fertility, there is a range of herbals that may interfere with hormone system and healthy fertility. So I asked you to talk to your healthcare provider about everything you take, any herbals to take. It would be too much to talk about it now, what exactly, but, just talk to your healthcare provider about what you take. For men, it's really important to know that supplements containing hormone-like substances, some men like to use them in order to increase muscle growth. They can be really detrimental for male fertility and can impair sperm development. So this is really something you should stop at once if you want to father a child.
Thank you so much. It's actually such a great addition to all of that information, as we provided what to take and now what to actually stay away from. So, but when you mentioned pollutants and the food, the pollutants, so you're talking about pesticides or what is
Yes, pesticides, for example. But we see today that the way we grow food has changed, and a lot of pesticides are used, and this is not, well, I mean, I think it's common sense, not a good idea.
Yeah.
So I would recommend, especially during the time you're planning for pregnancy, to prefer organically grown food, preferably regionally grown and seasonal. This way you have the best quality and the best content also of healthy vitamins and minerals in the food you consume.
No, that's a great tip. Thank you. So now I actually have a few questions from the women from our community about fertility supplements. Could you help me answer them?
I'll hope.
So let's see. One of the main issues actually women ask is about the time period when they're taking the supplements, because they're worried that they're taking it for too long and it might affect fertility. So how long should they be taking the supplements for optimal results?
Wow, that's an excellent question. Thank you so much for that. Well, first of all, supplements are no drugs. They are food. And the supplements that are designed for women are usually designed for long-term use. So very often they do not have very extremely high dosages. So we ask our patients to start a preconceptional supplement from the time they want to become pregnant until they are pregnant. There is no need to worry about overdosage. However, the situation is quite different for the male partner. In men, to boost semen quality effectively, quite high dosages are used. And these supplements for men are not designed for long-term use, but for a very intense regimen of roughly 3 months. For these 3 months, it takes for the spermatozoa to develop. So for men, we ask our male patients to take this regimen for 3 to maximum 6 months and then have a break for at least several weeks.
Oh, it's very good to know about males. I haven't heard that. So I think it's very important to note for everyone that even if a woman can continue her supplements, male should take a break for a little bit. But I think it's very good that it's also actually needed for around 3 months, let's say for men to take supplements to improve sperm health, because we need around 3 months also for women normally to take supplements to get all of the needed vitamins in place to be ready for pregnancy. So it's kind of aligning. If you start taking supplements together and preparing together, maybe looking at your lifestyle and starting eating healthier, I think it's another way to actually have a project together.
Absolutely. You are a team. And this is, deciding you want to have a baby, it's like the biggest adventure of your life. And really being on that as a team will make such a big difference.
Definitely. So now we know that women at least don't need to take a break. They need to start a little bit before supplements. Men should take a break after at least 6 months. What about age restrictions? Are there any age restrictions when taking Fertilovit supplements?
Well, not really. I mean, of course, the products have been designed for adults and not for children. That's an obvious age restriction. But apart from that, for example, we have a product that is targeted for women in their later reproductive years. It's called Fertilovit F35 plus. But all the products act systemically, is how we call it. That means while they have been developed for a specific purpose, they affect our entire body. And for example, if you're much older, for example, I'm much older, I still take that product if I have stress, and it helps me get through stress, hectic stages in my life. I can benefit from it, but also younger women. Younger women, for example, will benefit from the content of coenzyme Q10, which is very nicely researched to boost energy production in our cells, also in our oocytes, and this way contributing to improved oocyte health and oocyte quality.
Oh, and that is one of the main actually questions we get, also how to improve oocyte quality. So it's very good to know, and take notes, girls. It was actually so nice to talk to you. I'm so glad that you could be a guest on our podcast. So just to end, I would like to ask you for your top 3 tips for couples who are trying to conceive or who would like to improve their fertility.
Yeah, thank you so much. It's been a pleasure being here, talking to you. Pleasure being on your channel. Thank you so much for having me. Yeah, the 3 top tips. I think being on a fertility journey is a very special time in your lives. And while it sometimes may feel very challenging, it is also a big chance. It is a big chance for you as a team to establish healthy routines now that will benefit not only yourself, your personal health and well-being and your fertility, but also the health of your future family. The first step, if you smoke, stop now. Men who smoke have decreased semen quality. Women who smoke have to wait longer for a positive pregnancy test, and they endanger the health of their baby. Take this time in your life, as I said, to establish healthy routines together. Stay hydrated. Sleep enough. Relax. Have fun. Mind a healthy diet. Eat your 5 a day of fruit and veggie. Stick to healthy fats. And remember, fibers are a good friend of yours. And finally, we all know when a fertility journey becomes longer than expected, it can be very challenging for each of us individually, but also as couples. Please try to stay positive. Don't lose your fun of life. Don't lose your partner. Don't lose your joy of sex either. And I really can tell you, in the course of my work, I've had the privilege to witness so many miracles. And there is hope out there. And I keep my fingers crossed for you that you too will soon experience your very own miracle yourself. All the best.
Oh, thank you so much, Birgit. Those such nice and kind words and very good tips. We hope that all of you enjoyed this episode as much as I did. And I would like to thank again Dr. Birgit Wogatzky for coming here and for sharing all her knowledge and expertise in this area.
Thank you so much. It's been a pleasure, and I hope we'll meet again soon.
Definitely. I hope so too.